Hey everyone, welcome to the Autoimmune Dietitian YouTube channel. My name is Annie. I'm a registered dietitian and I work with people struggling with autoimmune diseases. In my work with my clients, I help them use nutrition and lifestyle as a way to overcome symptoms and improve their disease and hopefully, be able to help them live a long life with minimal symptoms and minimal pain. So today we are talking about who can benefit from anti-inflammatory diets. They are all the rage right now. They're super popular, and they seem to be the magic cure for many different conditions. And the truth is, they do actually work, and they do work for not just only autoimmune diseases, but for a lot of other things. So today I'm covering a few of the other medical issues that this diet can help, plus I'll give you a few tips at the end to help get you started on an anti-inflammatory eating pattern. So before I jump in, I just need to attach a disclaimer to this video that the information in today's talk is not the substitute for the diagnosis, treatment, or care of disease by a medical provider. This is for informational purposes only. So please consult your qualified health professional for any changes to your medical care. All right, so what are anti-inflammatory diets? So anti-inflammatory diets are designed to fight or lower chronic inflammation in the body. While inflammation is a healthy and normal response, it should be a very short-lived process. In some instances, inflammation goes unresolved. This happens when the body is either overwhelmed by inflammatory cytokines or has continual exposure to inflammatory triggers. When inflammation stays for too long in the body, it becomes chronic inflammation. Chronic inflammation is the underlying cause of many diseases and conditions. This is why many people have turned to anti-inflammatory eating patterns. Along with medication, food can be incredibly healing for a lot of these issues. So what conditions do they benefit? So anti-inflammatory diets can benefit a wide range of diseases and conditions. Here are a few of the things that can help. Autoimmune diseases, obviously. Autoimmune diseases are a condition where the body attacks itself. The immune system cannot differentiate between self and invader, so it damages healthy cells, which causes inflammation in the body. Researchers have looked at several anti-inflammatory eating patterns to see if they improve autoimmune disease symptoms. In one meta-analysis on rheumatoid arthritis patients, the Mediterranean diet was effective in lowering pain. In other studies, the Autoimmune Protocol, or AIP, helped some people with inflammatory bowel disease achieve remission. There have been lots of other studies on anti-inflammatory diets and other specific autoimmune diseases. I don't have time to cover them all here, but if you just do a PubMed search for anti-inflammatory diet and autoimmune or your specific condition, I'm sure you'll find something related to that. All right, the next one is cardiovascular disease. So cardiovascular disease refers to a number of conditions related to the heart. Many of these diseases are caused by chronic inflammation. And what's actually really interesting is that with some autoimmune diseases, your risk of developing cardiovascular disease actually increases when you are diagnosed with that autoimmune disease. So this is also, a really important one to mention. So in terms of diet, researchers have found a positive relationship between pro-inflammatory foods and elevated cardiovascular disease risk. They also found, the more anti-inflammatory foods you include in your diet, the lower your risk is of developing a heart condition. All right, type 2 diabetes. So insulin resistance is the hallmark feature of type 2 diabetes. This is when your cells stop reacting to the hormone insulin that is produced after eating foods with sugar or glucose, which is the main building block of carbohydrates. People with this condition tend to have higher blood sugar and higher insulin levels, both of which are inflammatory. So the Mediterranean diet is the most studied type of diet for type 2 diabetes. This eating pattern lowers blood sugar, lowers cardiovascular disease risk, like I mentioned above, helps with weight loss, and also can improve diabetic dyslipidemia, which is pretty awesome. The last one I'm going to mention is cancer. So not everyone associates diet and cancer kind of together or thinks that diet can help prevent cancer, but it actually can. Fascinating, I know. So inflammation is often an underlying trigger for the development and progression of cancer. In fact, most cancers now are triggered by environmental factors such as diet, lifestyle, and environmental exposures. It's not genetics. Very few cancer diagnoses are tied back to genetic factors. So the American Institute of Cancer Research has looked at the connection between diet and cancer. They found that higher inflammatory diets are linked to an increase in cancer risk. Also, anti-inflammatory diets have lowered the risk of developing certain types of cancers, including prostate, lung, breast, and ovarian. Super interesting. All right, so how do you get started with an anti-inflammatory diet? So if you know me and you've heard me kind of talk about, getting started on things or setting goals, I am of the camp of starting off slow and progressing as you feel comfortable. I believe that, taking one step at a time, not kind of doing a cold turkey, but just going slowly at it will not only help you stay motivated, but it'll also help you you'll be more likely to succeed. So my first tip is to, remove those foods that are known as inflammatory. And these foods include things like processed meat, sugar, processed oils, food additives, food colorings, food flavorings, fried foods, excess alcohol, saturated fats from animal products, and refined carbohydrates. So I would pick one from that list and try to eliminate it, or at least cut down on your intake for maybe a week or so. And as long as you feel comfortable doing that and it seems easy, move on to the next food. That way, you're slowly tackling that list, making small but meaningful changes. And over time, you will eventually eliminate or, really reduce your intake of all of them. The second one is I always like to focus on what you can eat. People are always so focused on what they can't have and feel deprived, but think about all the things that you can eat. I mean, the list of inflammatory foods does seem long, but I'm going to list off the things that you can eat, and it's going to seem like there's a lot. So fruits, vegetables, legumes, whole grains, omega-3 fatty acid-rich foods like salmon, mackerel, sardines, avocado, chia seeds, coffee and tea, dark chocolate, herbs and spices. Those are like whole food group lists, right? Like fruits, vegetables. There's so many that falls into that category. So that's like a lot of different things that you can eat. And my goal for you with these foods is variety, okay? We know that the gut microbiome loves variety, and all different foods have different important chemicals and antioxidants and inflammation fighting components that really, work together to fight inflammation. So the more variety, the more colors, again, like eating lots of different foods will really support your gut, will support your health, and you will feel a lot better. All right, so just to recap, today we focused on who can benefit from anti-inflammatory diets. And again, that's a very short list. There's a lot of other conditions that anti-inflammatory diets can benefit, things like fatty liver disease, it can support your kidneys, it can help with asthma. Asthma is actually an inflammatory condition. So there's lots of things that anti-inflammatory diets can help. So if you would like more help managing your autoimmune disease, your digestive issues, or just want to reduce inflammation in general, I would love to chat with you. I offer free 15-minute discovery calls to chat more about your goals. I also have a group program that is starting in a couple weeks. So if you're interested in that, it's called Ditch Your Inflammation. It's my foundations program. So if you go to my website under services, go to foundations, you'll learn all about it. It's going to be a great 4-week program. It doesn't take a lot of time on your part, but we're going to be eating a anti-inflammatory diet for 4 weeks and see how you feel. And I think you'll feel a lot better. So that is another option in working with me. I also put out a newsletter every Thursday. It comes to your inbox at Thursday morning. You can subscribe to that using the link in my YouTube profile. If you don't like it or you don't think it's helpful, you can always unsubscribe. You won't hurt my feelings. And lastly, if you enjoyed the video, please hit the little subscribe button. These come out every week, always discussing something related to food, nutrition, inflammation, autoimmune disease, how you can manage it better. I'm really here to just help you. So I hope you're finding it helpful. If there's any topics of interest, drop them in the comments. I would love to know. And that's it. So I will see you next time. Thank you for joining me and have a great day.